The top this morning, a frenzied response to news of H1N1 vaccines soon to be available in Kent County. That announcement coming this morning, bringing a flood of reservation calls to United Way's phone banks. In 24 Hour News 8's Ken Colker, he was alongside operators as those calls just kept coming in.
Today, United Way's 211 Center in Grand Rapids started taking appointments for H1N1 vaccines for those at risk in Kent County. And almost immediately, the phones were ringing off the hook. And there's a reason for that. Not enough vaccines to go around. Not by far. United Way, working with the Kent County Health Department, is taking appointments for the next 3 Saturdays at a pair of clinics in Grand Rapids, the Fuller Clinic and the Sheldon Clinic.
We asked the public to bear with us, that we are experiencing very high call volume. There are probably a 14-15 minute wait time at the present time. We are adding more operators throughout the day.
These health clinic vaccines are for only those at risk in Kent County. People aged 6 months to 24 years, pregnant women, child care providers, and patients with compromised immune systems. There are an estimated 300,000 people at risk in the county. So far, Kent County has received nearly 31,000 vaccines, though most went to vaccinated healthcare providers. Another 22,000 or so are expected this week. Some of those are going to private doctors' offices for patients at risk. The health clinics will get up to 15,000 doses over the next 3 Saturdays, covering about 5% of the at-risk population. Health officials say appointments are still available by calling 211 in Kent County. For more on the clinics and the appointments, go to our website at woodtv.com. In Grand Rapids, Ken Colker, 24 Hour News 8.
And for more on that big shipment that's headed our way, I'm joined this morning with the Kent County Health Department official, Bill Anstey, to talk about it. Bill, where are those vaccines right now? What are you guys doing with them?
Well, we're doing 2 things with the vaccine. We have some set aside for the clinic that we're having this Saturday, and we've also pushed out vaccine to our primary care providers so that they can get vaccine into their clients.
Very good. And what's going to happen here on Saturday? You guys have 2 clinics that you're going to do over a 3-week period.
That is correct.
In which you're going to give away about 12,000 vaccines, right?
Yes, we're going to be having, the health department is going to be having clinics on Saturday, the next 3 Saturdays, starting on the 7th, 14th, and 21st at our Fuller location and our Sheldon location. In order to be attend one of those clinics, you need to make an appointment. We've partnered with United Way's 211 for that, so people can call 211. They can make their appointment for one of those 3 clinics and then show up at their date and time and get vaccinated. They need to be in one of the CDC priority groups in order to receive the vaccination.
So not everybody gets a vaccine. You have to fit into that specific type group that we have on our website. You can take a look at those. But also that 211 call center got rocked this morning. As Kim was talking about here, 600 appointments set up in just 2 hours' time. What was the idea with using the 211 system? Why did you guys go that route?
The 211 partnership is going to work out really well for us. In the beginning, we weren't sure what the call volume was going to be right in the morning, and we had to work out a couple things. But now there are lots of operators taking calls. If the queue gets really long, there's a failover mechanism where other 211s throughout the country will be able to take the reservations. And when I was there earlier today around 10 o'clock, there were about 14 people in the queue, and the average wait at that time was about 4.5 to 5 minutes. People need to remember that, there's going to be some delays in getting in once you get in and call 211, because, having the vaccine, the demand is really great right now. But they can continue to try, they can get through, and they'll get served very well by 211.
Well, if that delay is less than 4 minutes or 5 minutes, as you said, then it's less time you spend on the phone with the phone company, for example, or the cable company, really.
In the beginning, it was a little rough, but now it's much better now.
Are you surprised by the kind of number of calls and the volume you got?
No, we knew that the demand was going to be really great once we made the announcement of our clinics, and we wanted to prepare for that and felt that 211 was a good partnership in having their abilities and their capabilities to handle the calls. We knew that there would be a lot, and we planned accordingly.
Let's talk about those clinics that you're having here. You're planning on doing about 4,000 vaccinations in a day.
Right.
2 clinics, so 2,000 vaccinations at each clinic. How many people are you going to have there? How many nurses do you need to be able to accomplish that?
At our Fuller location, for example, there'll be about 45 to 50 staff there. And it's not just nurses. There'll be people doing the registration, the paperwork, scanning, IT support, just the whole runners and making sure supplies are there. At our Sheldon clinic, which is going to do a little lesser volume, it'll be between 30 and 40 staff members there.
Now, when you're setting up these appointments with people, they call in. Are you just taking them at their word that I'm a pregnant person or I'm somebody that fits within the CDC's guidelines, or is there some kind of system to determine that maybe this person was being a little disingenuous with us to start out with, and maybe they shouldn't get that vaccine? We don't want it to go to them when it could go to somebody who really needs it.
211 has a script that they go through and review everyone that's calling and asking certain questions to see if they qualify for one of the groups. And at that point, if they do qualify for a group, an appointment and a reservation is made. And for those that are not all that forthcoming, yeah, that's an issue for us, but they're still going to get their appointment, they'll still get vaccinated.
All right, well, I guess you can't always control for somebody who might not be telling the truth.
Right.
Thank you very much, Bill. I appreciate your time here. We're going to be following this very closely.